Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Postpartum hemorrhage is the excessive bleeding after childbirth, which can be life-threatening if not managed properly. This heavy bleeding can happen right after delivery, during the first 24 hours or weeks following childbirth, making it crucial to monitor new mothers closely. Postpartum hemorrhage is a leading cause of maternal mortality, especially in developing countries where access to healthcare is limited. It is important for expectant mothers and their families to be aware of the signs and symptoms, as early recognition and prompt treatment are vital to prevent severe complications. Several factors can contribute to postpartum hemorrhage. One common cause is uterine atony, which is when the uterus fails to contract properly after delivery. This contraction is essential to stop bleeding from the site where the placenta detached, ensuring the mother's safety. Another cause is retained placenta. This happens when parts of the placenta remain attached to the uterus after delivery, preventing the uterus from contracting fully. Tears in the cervix, vagina, or uterus during childbirth can also lead to excessive bleeding. Uterine rupture is a rare but serious condition where the uterus tears during labor, leading to severe bleeding. Other risk factors include multiple pregnancies, prolonged labor, and obesity. Excessive bleeding is the most obvious sign. This may involve soaking through a sanitary pad every hour. Other symptoms include a rapid heart rate, shortness of breath, dizziness, nausea, chills, severe abdominal pain, paleness, weakness, passage of large clots, and low blood pressure. It is also important to remember that every woman's experience is unique. Any unusual bleeding or discomfort after childbirth should be reported to a healthcare professional immediately. If you can't reach them, go to the nearest emergency room. Describe your symptoms clearly and accurately, and be prepared to provide information about your medical history and pregnancy. Time is of the essence in treating postpartum hemorrhage. Early intervention significantly improves outcomes. Delaying treatment can lead to serious complications such as anemia, shock, and even death. Prevention involves the active management of the third stage of labor by administration of uterotonics immediately after delivery to promote uterine contraction and reduce bleeding. Regular monitoring during labor and immediate postpartum period to identify and manage risks early. Adequate antenatal care by identifying and managing risk factors before and during pregnancy. Treatment includes use of uterotonics. These are medications such as oxytocin or methylagometrine to help the uterus contract and reduce bleeding. Uterine massage is one technique used to encourage contraction and reduce blood loss, repairing any tears in the birth canal or surrounding tissues. If the placenta is retained, it may need to be manually removed by a healthcare provider. In cases of severe bleeding, procedures like uterine artery ligation, repair of lacerations, or hysterectomy may be necessary. Administering blood products to replace lost blood and restore blood volume. Administering intravenous fluids to maintain blood pressure and hydration. Treatment typically involves a combination of measures tailored to the specific needs of the patient. Healthcare providers monitor women closely during and after labor, watching for any signs of complications. They can identify risk factors early on and take appropriate measures to minimize complications, providing peace of mind to new mothers. Thank you for watching. Please don't forget to like, subscribe and share.